and Assalamu alaikum, Ultrascan Diagnostics. Now, this is the CBCT of the patient that you had requested. The area of interest highlighted to us is the upper right first molar region and the lower left first molar region. The upper right first molar region has broken down roots present. All three roots are present. The tooth is slightly placed distally. Whereas the lower left is edentulous, we can see that there is an extraction socket and we don't see any visible bone grafting material here. Now moving to the panoramic view, on the panoramic view we can see we've got adequate space here, but bone quality and bone dimensions we will show you very soon. On the upper right segment, we do have a little bit of a periapical sinusitis present as well. So that needs to be evaluated in this CBCT. So moving to the upper right segment, this is the mesiobuccal root. We can see that there is a perforation of the sinus cortical plate. The Schneiderian membrane seems to be intact. We don't see any sinusitis spread all over into the sinus. It's localized along the buccal cortical plate. Moving to slightly the distal aspect, this is the parietal root. You can see on the parietal root that there is a periapical radiolucency with a perforation into the sinus. On we can see very weak interradicular bone, and this is the distobuccal root, which is very closely associated with the buccal cortical plate on the top right hand corner. Now we have placed a virtual biohorizon implant. The idea is that once the roots have been extracted, there will be very minimal bone quality. Approximately D3 to D4 bone quality is going to be present. So this might need a sinus lift, will definitely need a sinus lift, also will need bone grafting and bone augmentation in this region. So the implant placement, if we go right in the center of the ridge, is going to be somewhere here. We can see that we're approximately 3 millimeters into the sinus. This can be done through the internal sinus lift approach, or a lateral window approach can be done. On the panoramic, we can see the yellow part corresponds to the future crown, whereas the green part is the implant fixture. Now, this is a 4.5 or 4.6 millimeter diameter and a 9 millimeter, which is the minimum height that we could have placed here. But you can place a slightly smaller in height, but then the bone quality is not sufficient to support that. Moving to the lower right hand corner, the lower left hand corner, my apologies. This is the lower left hand corner. This is where the mesial root has been extracted, and we can see that the buccal cortical plate is slightly, very negligibly intact. We do see a little bit of a radio opacity. We can suspect that this is grafting material, but this has not materialized into solid bone. So the bone quality in this region is going to be approximately D3 to D4 as well. I would say it's D3 because we have cortical plate on the lingual aspect. Moving to the interradicular area, we've got sufficient bone here. This seems to be well grafted bone. And then moving to the distal root, we can see that again we've got thinning of the ridge as along with a cavitation present inside the bone. So this is not very healthy bone in terms of implant stability. This aspect of the radio opacity is the cantilever effect of the crown that is present on the lower left 7. Now we've also placed a biohorizon implant in the center of the ridge, which has the best bone quality, and this is where the implant has been placed. The green part corresponds to the implant, whereas the yellow part corresponds. Now this is a 4.6 diameter and a 9 mm. We can't go longer because this, just to give you an idea, if we go for a 10.5 mm implant, we will see that the 10.5 implant is going to then this redness shows that this will invade the 2 mm, the gap that we are supposed to have between the apex of the implant and the inferior alveolar nerve. So a 9 millimeter implant should be sufficient here as well. This is how the tooth looks on the 3D rendering. We will need bone augmentation in this region so that the implant can be supported by good quality bone post implant placement as well. We will be sharing an implant planning report. If there are any further questions regarding this case, please feel free to reach to our team. Thank you very much.